So I'm part of the recruiting committee. I'm here today with my colleagues, Rachel Yarbrough, our graduate student coordinator, and Doctors Penny Pereira, Tim Devanch, and Hao Wang, who are all professors in the department as well. And our agenda for today is to just briefly talk to you about what is EHS, and more specifically, what is EHS like at the University of Michigan. Since that's a program you're interested in, we'll talk a little bit about what some of the careers are that our students go on to have, what our degree options are, and what makes a good applicant. But importantly, we like to spend about the last 45 minutes or so of this session giving you time to talk to us and ask the questions that you have. So at any time you can post questions in the chat as well. But after we go through our little presentation, we'll have some breakout rooms where you can ask us your questions about either the PhD or the master's, whichever one you're interested in. And then after that, we'll have a breakout room where you can actually meet with our current students and ask them questions about their experiences here too. So at this kind of event, we usually have too many people that go around in a circle to introduce ourselves. But if you'd like, you can put in the chat, maybe tell us who you are and what degree you're interested in. If you don't know yet, that's okay too. Why are you interested in EHS? And also, what is your favorite season or holiday? You don't have to answer all those questions, but you can answer any of them you'd like about yourself so we can all get to know each other. And I'll fill out mine too when I stop talking. But yeah, so feel free to, kind of just read everyone's responses as we go along here. But in the interest of time, I'll kind of get through these slides here. So this is a way that I like to think about environmental health sciences. It's one field, but it's so many different neat things. So if we start at the bottom of the circle, some of us identify the drivers of health issues, like where are these toxic exposures coming from? And in this picture, it's showing people working at an electronic waste recycling factory where a lot of toxic exposures occur. So kind of like finding where are these drivers of hazards in the environment. Then if you kind of go up around the circle clockwise, some environmental health scientists monitor and prevent the toxic exposures that we know about. See how much is getting into the environment. Is it getting worse? Is it getting better? What can we do about that? Some of us focus specifically on worker health and protecting workers from toxic exposures or hazards in their daily job. Some of us work on screening and mitigating consumer exposures. There's so many chemicals on the market. There's so many products out there. And what of it is, which of these products are safe, which are not? What do we do about that? And then also, many of us also work on understanding how are these exposures getting into the body and actually causing damage? How does something lead to cancer? How does something lead to a child development problem? And how do we mitigate that and stop that? So there's a lot of neat things that we do. Even the people from my department here today, we all have very diverse backgrounds and work on different parts of the circle. And I imagine all of you will too at some point in your career. So that's what the field is like, but what is environmental health like at the University of Michigan? We have a lot of great scientists and practitioners specializing in those different areas, but we're just also a pretty tight-knit community that has collaborative faculty, a deep sense of community. We have a lot of community activities to try to, make sure we can all get together, staff, students, faculty, postdocs, that we're not isolated here, that we have opportunities to connect. We have innovative teaching, and we're situated in the University of Michigan, which is an academic powerhouse with a lot of great resources for student projects, for research, for travel to conferences, and many other things that you have access to just by being at the University of Michigan. As a department specifically, this is how big we are. So this year we have 81 students. You can see we have a big group of PhD students right now. We also have about 32 MPH students, 14 Master of Science students. We have 17 core faculty members. 4 of us are here today on this call. And then we also have lecturers that teach some of our key classes that we need in the curriculum as well, and that have been doing it for many years. We have some specialty areas. We have a lot of individuals working in environmental health policy, working with things like epigenetics, exposure science, industrial hygiene, health impacts from climate change, cancer prevention, and more. So with that, I'd like to hand over to my colleague, Dr. Pereira, to talk about this next session.
Thanks, Dr. Goodrich. Hi, everyone. Thanks for being here today. I'll give you a brief overview of what life in Ann Arbor is like. It is considered one of the number one best college towns in America, most educated city, best place to live, and one of the top 10 best cities for sports because of football and other great American sports that everyone likes. And it is also one of the most beautiful college campuses in America, one of the top 25. And right now, outside, the leaves are turning red and orange in colors, so it is very beautiful. And just in Ann Arbor, downtown Ann Arbor is just a short walk away from campus for restaurants and bars. And during the summers, we have an art, music, and culture festivals here, an art fair, and a lot of things to do in Ann Arbor. And the university, this culture is also very diverse and welcoming, and so is our department. And we'll talk a little bit more about how our department welcomes and values DE&I, diversity, equity, and inclusion. And as Dr. Goodrich would like to show, that there are a lot of parks and biking trails in Ann Arbor. So that's something that if you're interested in, that's something that you have access to as well. Next, this slide kind of talks about what do our graduates do, and how many of the students that graduate from our programs get employed. So this is showing some statistics about the 2023 graduates, showing that 100% of the students that graduated that year are currently employed. And it kind of shows the pie chart down below to the left, shows three categories of the response from 26 students from these graduate outcomes. 65% of the students say, I guess alums say that they are employed, and 31% of them say that they are pursuing an advanced degree. So for example, if they did a master's degree, Master of Science, they're currently pursuing a PhD or something similar. And there's 4% that have other intentions. And if you look at the right side of this pie chart, it kind of talks about employment by sector. This shows that 40%, roughly 40%, well, one third, a little bit more than one third goes to educational or research system type of employment, so other institutions that are universities. And about 33% goes to private sector, and a similar one third proportion kind of goes to government. But this is not all of the employment by sector. In the next slide, we can kind of look at all of these jobs associated with a degree in EHS. So these common job titles can be put into a few little bins, being an analyst or industrial hygiene sector, or being a health scientist or a scientist type of job title, or related to environmental health as a consultant, or looking at governmental jobs as regional manager or planner, or as a researcher, or additional titles, and even some that go beyond EH&S, some things that can relate to public policy or law. Next slide, please. Thanks. And switching gears to talking about DE&I, our department highly values DE&I, and this is a quote from what our mission and vision is for the department. I serve as a co-chair for the departmental DEI committee, and our committee is dedicated to creating a diverse, equitable, and inclusive environment for everybody, including students, staff, postdocs, and faculty. One that is that creates an environment where every voice is heard, welcomed, and respected, especially in this day and age. So some of the things that we do as a committee includes some of these are some of the past events that we have put together. Picture a Scientist is a movie screening that talks about women in academia. And recently we also did a movie screening this year called Something in the Water, which talks about environmental exposures and public health impact. And every semester, as the DEI committee, we also organize a cultural potluck. So you can kind of represent a little piece of home or your grandma's favorite recipe in our department. And it is very well attended and something that everybody looks forward to. But not only that, we also kind of work on facilitating some workshops and training programs to improve DE&I culture in our department. We also have monthly community conversations around relevant topics for current topics. So this can include racism and privilege in academia, gender equality, non-binary inclusion, and some things that can even impact the students and faculty, staff, and postdocs' day-to-day lives, like size inclusivity in the planning and use of a lot of the tables and chairs in our community as well. With that, I will switch gears and give the podium to Dr. Dvanch.
Thank you so much, Dr. Pereira. Hey, hello everyone. It's great to be with you all today. A little bit about myself before I talk about curriculum. My name is Tim Devanch. In addition to being a professor in the department, I also serve as an associate chair. And then this is the most fun, I have the absolute pleasure of chairing our admissions committee. So I lead the committee who is very excited to be receiving and reviewing the applications from you all in the weeks and months ahead. All right, so what are these degree options? We have both master's degree options as well as doctoral degree options. So we'll take a few minutes to kind of walk through those. On the master's side of things, we offer both MPH or Master of Public Health degree opportunities, as well as Master of Science degree opportunities. And we'll talk in a minute about what the difference is between those two. We also offer a couple of doctoral or PhD degree programs. Next slide, please. All right, so starting with those master's degree programs, and importantly, making a distinction between the differences between our Masters of Public Health, or MPH, and our Masters of Science, or MS. So the Master of Public Health degree, the evaluation is primarily based in courses, right? So the courses that you take, the assessments that are given, and the grades you receive through those evaluations primarily take place in your courses. Through the MPH degree program, you're learning current understanding of scientific knowledge and then being trained to go out and apply that knowledge in a professional public health setting. In addition to coursework, which we'll talk about in a minute, there's also importantly the summer between the first and second year in the degree program, there's a required internship and applied learning experience where you'll very importantly leave the classroom, right, and go out and actually begin to apply some of the practice of what you've learned, but then also gain some really great experience working with an external public health organization. So in contrast to the MPH, our Master of Science program has much more of a research basis to it. So in addition to required courses and evaluation in those courses, a big part of your evaluation also takes place by your thesis committee, who kind of oversees and supports you in conducting your research thesis. So while you'll gain a current understanding of knowledge, you'll also be obtaining new knowledge as part of your own research that you'll be conducting. And you'll be trained to be a scientist after completing the program. Our MS degree does not require an internship. However, in place of that, it does require basically that summer between the first and second year is almost entirely devoted to research. I do want to make one last statement. For those of you interested in a Master of Public Health degree, While there's not a research requirement, you are absolutely encouraged, and many of our students do get involved in research projects. As Dr. Goodrich mentioned, there are so many opportunities here and so many wonderful research projects that you can spend, a few hours a week to contribute to and gain some experience in that regard. Next slide, please. All right, so within either of those degree programs, the Master of Science or the Master of Public Health, environmental health sciences in itself sounds like a pretty focused degree. We actually have several specialty areas that going further down, focusing within environmental health sciences, and we'll highlight each of them briefly here. Next slide. Okay, so we actually have two distinctly different Master of Public Health degree programs. One that's in environmental health sciences that then has the opportunity to focus in on some specific areas, which we'll talk about in a minute. And we also have a separate degree program, Master of Public Health program, in environmental health promotion and policy. In any of the MPH programs that you might apply to and enroll in, you have about 1/4 of your coursework that's dedicated to pillars of public health, courses and topics like biostatistics, epidemiology, health behavior, health management, and so forth. You then have about another 1/4 of your courses that are focused on our environmental health sciences core. So understanding the basics of exposure science, essentials of toxicology, occupational and environmental disease. So all of these types of foundations of EHS that we would expect all of our students to be able to leave and go out with. There's also some specializations, right? So about 1/4 of your space in your coursework is spent within that focus area, which we'll talk about here in a minute, what some of those focus areas are. But then also importantly, you do have some elective freedom, right? So about 1/4 of your coursework is allocated to choice. You can take those courses that you always wanted to take. There's also some things called graduate certificates that you also have that we'll talk about in a minute. But just to summarize there at the bottom of the slide, all of the MPH degree programs, regardless of focus area, do have a required internship component that students typically complete during the summer between the first and second year in the program. Next slide, please. Okay, so I'm really quickly going to just kind of buzz through a series of slides here that highlight some of those focus areas that you might choose to. And these are irregardless of whether you're taking the MPH or the MS. So in exposure science or industrial hygiene, this is an area of specialization focused on occupational health and safety, right? And so there's a big need for this health and safety in the workplace. And we have programs both in the MPH as well as in the MS that students can choose to pursue. Next slide, please. Another focus area is on environment, sustainability, and health, right? So those of you that are interested in the interplay between climate change and human health, environmental quality and sustainability and human health, right? So you get that SPH core, you get that environmental health sciences core, and then you can focus in specifically on environment, sustainability, and health. Next slide, please. We have another track or focus area on occupational and environmental epidemiology, right? So these are folks that collect data on exposures, how much were we exposed, when were we exposed, what type of agents we were exposed to, and then also combining that with data on health outcomes, right? Morbidity, mortality, what were the diseases, what were the symptoms, what were, in worst case scenario, death rates, right? And building models to basically do some analyses of the associations between those exposures and those health outcomes to better understand the impact of the exposures on health in the first place. Next slide, please. Yeah, this one on environmental health promotion and policy. This one is geared specifically towards students who want to leave the program and go out and directly impact positive change, whether it be at a community level, at a national or federal level, or even at an international level. So students in this program have that SPH core, they have that EHS core, and then you go through a series of courses around environmental policy, environmental regulation, environmental law, and learn the best ways to engage with stakeholders in all of these community dynamics to best improve policies and regulation in order to reduce those environmental exposures and improve health. Next slide, please. There's also within the MS or Master of Science degree plan, kind of this pie chart here. You have less coursework in the SPH core, less coursework in the EHS core. You still have some of that elective freedom to take individual courses that are typically supporting your thesis work. But then, yeah, you have probably about a quarter of your time is spent actually conducting your master's thesis research. And yes, you do actually get academic credit for the effort of that research. Next slide, please. And then, yeah, our last kind of focus area that we haven't touched on yet is toxicology, right? So we have exposures that take place. We have perhaps some health outcomes that result from those exposures. But toxicology is a focus area that is specifically looking at what mechanisms are occurring or what processes are occurring within our bodies, right? That actually lead from that exposure to a specific symptom or outcome. Next slide, please. And then for those of you that might be an undergraduate, specifically a junior undergraduate, either at the University of Michigan or Spelman College, we do have something called an accelerated master's degree program, which allows you to complete both a bachelor's and a master's within a total of 5 years. So if this is you, probably just insert something into the chat and we'll make sure it gets addressed. Next slide, please. All right, so moving from our master's degree programs to our doctoral degree programs. In contrast to the master's degree, which are typically 2-year programs, both the MS and the MPH are 2 years total or 4 academic semesters with a summer in between. The doctoral programs range from 3 to 5 years, but a typical duration is about 4 years total of study. As you might imagine, the doctoral program, either in environmental health sciences or our doctoral program in toxicology, are highly research focused, right? So there is some coursework that's required. Students complete a couple of research rotations under the mentorship of a couple of different faculty. They formally prepare their doctoral research and propose it. They, with the help of a full dissertation committee, conduct their research, do their data analyses, get it all written up, and then formally present and defend it. So as you can see in this pie chart, right, maybe about a quarter of your time or effort during your time in the program is around specific courses and research rotations, whereas most of the time is spent directly on the research and writing your dissertation. Next slide. Okay, so we've talked about those electives, right? All of these degree programs have some elective space in the curriculum. You are absolutely welcome to choose individual courses that are of most interest to you. You're not limited to our department. You're not limited to our School of Public Health. You can take courses across the entire University of Michigan, which is truly an amazing opportunity. Another use of that elective space is to complete something called a graduate certificate. So this might be analogous to the undergraduate version of a minor, right? So in undergrad, many programs, you major in something, and then you kind of minor in something else. So at the graduate level, in addition to getting a degree in environmental health sciences, you can actually complete a graduate certificate that's usually composed of 4 courses combined that result in this formally being listed on your transcript when you graduate, but an expressed kind of additional expertise in some specific focus areas. one on environmental justice, for example, one on science, technology, and public policy, risk science, and human health. This is not an exhaustive list. These are some of the courses that are commonly of interest to our current students. You also have the opportunity for a dual degree program. So for those of you that are interested, know that you can combine your master or doctoral degree in environmental health science with another degree. This, of course, typically adds some additional time to your overall plan of study. Next slide. All right, so talking about borders, with regards to your studies and your experiences, they're not limited by borders. So whether this is for master's students who are completing the required internship, or for either MS or doctoral students who are conducting research, this can be quite local, perhaps right here in Michigan. It could be anywhere in the US. It can be anywhere in the world. We have an amazing Office of Global Public Health in our school here at Michigan that is a wonderful source of support for students. Thousands of dollars to support your internship overseas, to support your research overseas, and so forth. And this slide just illustrates, again, a very small sampling of some of some of our past students or previous students have completed their work in terms of global environmental health opportunities. Next slide, please. Finishing with just a little bit about financial support. And I won't go through this whole list here. I'll let you kind of read through the slide, but I will highlight a couple of important ones independently for those of you that might be applying to a master's degree program, and then separately for those of you who might be applying to a doctoral degree program. So for those of you in the master side, either the MS or the MPH, the important takeaway that I want you to realize, if you take nothing else from this slide, is the one at the top where it talks about EHS department scholarships. So by applying to our department programs, you are automatically considered and evaluated for departmental merit-based scholarships. You don't need to do anything to be prompted, to prompt us to do this. We will automatically consider this. So there's one round of review that determines whether you're admissible to the program. And then there's a second round of review to determine how much department scholarship you might be awarded. And a very large number of our students receive these department scholarships as part of their admission offer. Flipping to those of you that are interested in applying to the doctoral program. This one is, it's very competitive in terms of admission rates. And the reason is because it is the policy of the University of Michigan's Rackham Graduate School that all doctoral students offered admission are fully funded for their entire time, right? So that roughly 4 years of study. That funding includes full tuition support, a monthly stipend, as well as fringe benefits, including health insurance. So because of that, it's highly competitive. Your funding package could come from a variety of different sources. It might come from a faculty's research grant. It might come from a doctoral training grant that we have here in our department and in our school. It might be partially composed of, for those of you that are interested in getting teaching experience, serving as a graduate student instructor in one of the courses. So if you're a doctoral student, please know, if you take anything away from this slide, that if you are offered admission to one of our doctoral programs, it will come with full financial support. Next slide, please. All right, so a little bit about the application process. So as you're wading through these in the weeks ahead, I want you all to know, or we want you all to know, that it's a very holistic admissions process. There's not a minimum GPA that we're looking at, a grade point average. So there's not minimum grades in courses. To clarify, down there at the bottom of the slide, there's no GRE or graduate record exam. requirement for admission. And so we are looking at, what courses have you taken? Do you have kind of prerequisite science courses that are required depending on the program you're applying to? We're very interested in the statements that you submit, where we want to know about your motivations, your passions. Why do you want to gain a graduate degree in environmental health sciences? Please tell us that. We're very interested in knowing that. We also want to know if there was, anything that kind of maybe interrupted what you had hoped to accomplish before applying to graduate school. There are opportunities in multiple aspects of the application to let us know this. We do ask you to submit 3 letters of recommendation. Ideally, at least 2 of these come from academic mentors. Maybe it's an instructor for a class or a professor that you worked with on a research project. But we do require 3 of those letters as part of the application review. And then there is an opportunity to submit a very short, usually just a page or 2, CV or resume that kind of summarizes all that you've accomplished, both academically, but also outside of the classroom, job experiences, fellowships, other awards that you might have received. And then there's also an opportunity to specify, in lieu of the GRE, you can clarify your quantitative experiences, right, through math and statistics and managing data and so forth. And I think that ends this part of the presentation. I'm going to turn things back over to Dr. Goodrich to organize this or keep us organized.
Yes, so this is just a reminder about some kind of deadlines for applications too. We have a December 1st is our priority deadline. It's our required deadline for PhDs. But it's a priority deadline for scholarships for MPHs and MSs, but we do still accept applications after that date too. You'll start to hear from us. You'll hear about your admission first for master's programs as soon as we start reviewing them in batches, kind of starting in December. Most people usually hear in January, February timeframe. Doctoral students, applicants will get invited as kind of a first stage to a doctoral day in January if we are considering your application for funding. And then we'll kind of decide on who we have funding for after that point in time. And then for master's students, you'll receive your admissions letter first, but you may receive a funding offer when we figure out how we can split the scholarships we have amongst all the admitted students in February and March. So but those are things, some of that timeline is posted on our website, and you can always ask us questions about that as you're going.